Who is a good candidate for a hair transplant? Several factors make someone a good candidate for a hair transplant. The first is making sure that your expectations as a patient are on the same page as what we are able to achieve as hair transplant doctors. And that's the case in most cosmetic areas of medicine. Where there are problems between the patient and the physician performing the procedure is where expectations are mismatched to what the outcome is that we can achieve. And the things that limit our ability to perform the gold standard hair transplant is, say for example, if your donor area at the back is not adequate in order to achieve the outcome that you want. The donor hair is really important. It's the pantry that we go to obtain the hairs, to rob Peter to pay Paul and put those hairs on the top of the head in the baldy or thinning areas. If that donor area is not adequate, then we're not going to have enough in the pantry in order to put on the top of the head. So that's the first thing. Donor quality is important. And secondly, it depends what sort of area we're dealing with on the top of the head. If we're dealing with a particularly large area, then we may need to do a transplant, but also add auxiliary services in, such as scalp micropigmentation, in order to darken the skin on the scalp, to make it look or give the illusion, a smoke and mirrors effect, that you've got more hair on the scalp than what you do. And then of course, we also have to have a patient that's willing to consider the option of medication, because it's important to understand that a hair transplant does nothing to stop you from continuing to lose your existing hair. All a transplant does is deal with the past. It replaces those hairs on which that ship has sailed and we're never going to get back again. But it doesn't stop you from continuing to lose your existing hair, and that's where medication is absolutely critical. And you know, I've consulted several patients over the years where I've had to actually say, look, a transplant's not for you because you're not prepared to consider medication. If you don't consider medication in those instances, then a transplant is really going to look less good over subsequent years. And we want the transplant to carry you for another 10 to 20 years if we can, if not longer. And if you're on medication stopping you from continuing to lose your existing hair, then we can really realistically achieve that with a good, again, realistic transplant procedure. We also need a patient that is going to stick to their aftercare. Aftercare after a hair transplantation procedure is super critical. We need people to listen to the advice that we're giving and to follow the instructions to the letter. We sometimes find that patients, Dr. Spino calls it, trying to outsmart the aftercare instructions. We ask that patients don't do that. We write these instructions very carefully because of our wealth of experience in dealing with patients in that aftercare time frame. So please stick to the aftercare and you'll get a great result. We also like patients that are going to also come in for LED treatments and also participate in the PRP program, the platelet-rich plasma, after their transplant, because both of those treatments really promote rapid hair growth and also really kickstart your existing hair, not necessarily the transplanted hair, but your existing hair, really boot camping that and getting maximum growth out of it, so long as you're already on medication as well. So they're just some of the characteristics that make someone a suitable candidate for a hair transplant, whether that transplant is for eyebrow rebuilding, whether it is for rebuilding hair on the top of the scalp, whether it be for mustache or beard rebuilding, or for filling in a scar. We really take into account a lot of those characteristics that make someone a suitable candidate for a hair transplant procedure. We provide services to all members of the community, including female clients, male clients, and also those clients in the LGBTQ community, and of course anyone who may be transitioning between genders. We are experts at providing hair transplant procedures for all walks of life, and we look forward to meeting you and providing you with a service in whatever way we can.